Okay, let's jump right into a really big question. When you're facing a cancer diagnosis, the standard of care, chemo, radiation, surgery, that's always the foundation. But there's this fascinating idea emerging from the research. Can things like diet and exercise actually work with those treatments to improve survival? Let's take a look at what the science is starting to tell us.
To really understand why this is such a critical question, let's start with one of the most difficult diagnoses out there, glioblastoma. It's the most aggressive primary brain tumor, and it really puts into perspective the massive challenge that both patients and doctors are up against.
And the reality of it is, it's harsh. Even with the absolute best standard treatments we have today, the median survival for glioblastoma is just 12 to 18 months. That's a statistic that just screams for new approaches and for more tools in the toolbox. And that leads us to the core question, right? Beyond the standard stuff, are there other strategies we can use? Can things that are actually within a patient's control, like lifestyle, make a real, measurable difference? Well, the science is beginning to offer some pretty incredible clues. First off, let's briefly touch on exercise. There's a whole growing body of evidence that links structured, regular physical activity with better survival for cancer patients. It's a hugely powerful tool, for sure. But for this explainer, we're going to zoom in on an area with some equally dramatic, if not more dramatic findings: nutrition. So let's talk about diet. We usually think about it for, general health. But some of this new research is framing it as a potential therapeutic weapon. The whole idea is to strategically target a unique weakness that's found in a lot of cancer cells. And to get that, we need to talk about something called the Warburg effect. I know, it sounds super complicated, but here's the bottom line. Nearly 100 years ago, a scientist named Otto Warburg discovered that most cancer cells are, for all intents and purposes, addicted to sugar. They just guzzle glucose at this incredible rate to get their energy, while our healthy cells are way more flexible. And this is where it gets really interesting, especially in the brain. Your healthy brain cells are what we call metabolically flexible. If you take away glucose, no big deal, they can just switch over and start burning an alternative fuel called ketones. But many glioblastoma cells, they can't do that. Their little energy factories, the mitochondria, are broken, leaving them desperately dependent on glucose. And that flaw, well, that creates a potential opportunity. So you can probably see where this is going, right? Researchers decided to test a really cool theory in a clinical study. What if you could essentially starve the tumor of its favorite food? And they did this by putting glioblastoma patients on a ketogenic diet, which is designed to dramatically lower glucose and raise those ketones, all alongside their standard treatment. The setup was really simple but powerful. They followed 18 patients who were newly diagnosed. Then they compared the 6 patients who were able to stick to the ketogenic diet for more than 6 months against the 12 who couldn't. The big thing they were looking at was the 3-year survival rate. Okay, get ready for this. In the group that stuck with the ketogenic diet, the 3-year survival rate was an incredible 66.7%. Just let that sink in. We're talking about a disease where the typical prognosis is just a year to a year and a half. Now look at this comparison. For the keto group, 66.7% survival at 3 years. For the patients on standard care alone, just 8.3%. That is a more than 8-fold difference. I mean, that's the kind of result that just makes you stop and say, whoa. And, these are not just numbers on a chart. These are people. Take patient 1 from the study. They survived 84 months, that's 7 years, and yeah, they have a mild side effect, but they're back at work as a teacher. It's just such a powerful reminder of the human story behind the data. Okay, so starving cancer of its fuel is one approach, but there's another way to attack this problem, and that's by focusing on the environment around the tumor, specifically by fighting inflammation. So let's pivot and look at a huge study on over 1,000 breast cancer survivors to see how this plays out. So this was a really long-term study. They followed these women for, on average, almost 15 years after their diagnosis. And they used this tool called the Dietary Inflammatory Index, or DII, to score what each woman was eating. Basically, a high score means your diet is more pro-inflammatory. Think lots of processed foods, while a low score means it's more anti-inflammatory, full of veggies, fiber, and healthy fats. The findings were pretty stark. When you crunch all the numbers, the women eating the most pro-inflammatory diet had a 34% higher risk of death from any cause compared to the women eating the most anti-inflammatory diet.
It really shows how this constant, low-grade inflammation can just create an environment in the body that helps cancer progress. And here's a fascinating little detail. The survival benefit from the anti-inflammatory diet was actually strongest for the patients who were followed the longest, for more than 15 years. This really suggests that cooling off inflammation isn't some quick fix. It's a powerful, sustained strategy for improving your chances over the long haul. Okay, so what in the world do you do with all of this information? Well, the goal is absolutely not to go out and prescribe yourself a diet. It's about taking this amazing emerging science and using it to have a smarter, more informed conversation with your medical team. So here's a simple path for turning this knowledge into action. First, learn the science. Really understand what's going on. Second, write down your questions. Get specific about diet and exercise and how it might relate to your plan. And third, take that to your oncologist and partner with them. See if any supervised strategies might be a good fit for you.
Now, let's be crystal clear here. This is not medical advice, and these kinds of interventions must be strictly supervised by a professional. The whole point of learning about this research is to empower you, to enable you to have a more active, engaged, and collaborative conversation with the experts who are guiding your care. Because that partnership, that's the most powerful tool you have.